This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's weekly COVID-19 update is being recorded at 8:30 a.m. on Friday, May 15th. Well, we've hit the mark where we're starting to open back up things. The governor at 5 a.m. this morning allowed businesses to reopen on a limited capacity, I guess, would be the way to describe it. Certainly, there's plenty of us that need haircuts, so that's a good thing coming up for the weekend. But I think to reflect upon what we've learned in the last 60 days is really quite amazing where we were 60 days ago and so many unknowns. And as I reflect back upon it, I'm just honored to be associated with the intensivists and the critical care nursing and the floor nursing during this time, because as we start to gather the numbers for our outcomes, particularly the critically ill patient, it's tenfold higher than New York City when what they experienced at given times, and certainly much higher than Italy. And I think that's something we should be proud of. But as we start to open things back up, as I've said before, there's going to be clusters. There's going to be limited outbreaks with mini surges that we'll probably see. From a capacity, supply, staffing standpoint, we'll be able to handle them all. Not worried about that. We will get busy if the patients with chronic medical conditions that have been neglected start to have exacerbations and present to the hospital, which this morning, looking at the hospital census, that's starting to occur. Now, if we have a COVID spike with a significant inpatient census of chronic medical diseases, as well as now that we start doing surgical procedures in a greater volume, that'll make us busy. And because of that, we need to continue to be smart with social distancing when we can, do things virtually or telephonic when we can, not make unnecessary trips. I think one good thing that I've seen in the world is right now it's Australia's November, and they're not seeing a second wave of COVID cases. Their shelter-in-place orders or social distancing commandments, if you will, is about the same as the United States. So that's something nice to reflect upon. The bad news is Saudi Arabia, during the month of Ramadan, when it becomes very congested, and I believe Mecca this time of year, with shoulder-to-shoulder capacity as they visit the holy site, they have had an outbreak. And so that's not reassuring from a standpoint of competitive sports and large gatherings or crowds. So we need to continue that, keep that in mind. I know the governor has said less than 10 people, but you can have 8 people in a phone booth, and that's pretty close. Or you can have, 50 people in a 30,000 square foot gymnasium, and, they can all social distance. So be wise about that, and don't let simply the numbers make the call. We continue to monitor supplies and staffing, and I think I join with my colleagues, both nursing, physician, and in leadership, that it certainly was a lot easier to shut things down than it is to start back up. There's a lot of logistics and nuances that have to be accomplished, but we are accomplishing them. The goal is by the end of June 22nd specifically, to be business as prior to the pandemic. That continues to be a goal, and at this time, I still believe it's reasonably achievable. Bottom line, keep a clear head and quick hands, as well as clean hands and surfaces frequently. Cover your cough and your sneeze, and contain yourself if you're ill. We know what we do, we know how we do it, but it's times like these we learn the why. For the most up-to-date information on COVID-19, visit our website at unitypoint.org or the Centers for Disease Control and Prevention website at cdc.gov. Be well and stay safe. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.